and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So we have one member of the public wishes to speak. Is there more?
You gotta do your agenda first.
Oh, I'm sorry.
You're on 1 2.
Sorry, I'm on the wrong one. Is there any addition to the agenda? Make a motion to approve.
Second.
All those in favor? Huh?
Can you read the motion?
All right. Where's it at? Right down there, sir. I'll read it. Okay. Motion to approve the agenda as presented.
Second.
Thank you. All those in favor, we're going to do a voice vote because we have some missing. Monique?
Are they on the computers?
If they're on their computer.
I abstain. Oh,
Is everybody on the computers?
yeah, I did. Yes.
Lucas?
Yeah, I'm here. I vote aye.
Okay. Are you on your computer?
Can't you do it on your computer?
Yeah, I can.
Yeah,
Absolutely.
it'll show on the screen.
Okay.
Okay, we'll go ahead and do the computer vote.
We'll do the computer vote then. So everybody vote on your computer. Sorry, I'm going in for
And it's
Monique.
gonna be behind you because we have them on here. So that's a 6-1.
6-1. Motion carries.
Where's that?
Right behind you.
So Lucas, do you want us to see you?
Yeah, is my video not on? I'm sorry.
No.
No. If you don't want it, that's fine too. I don't care. I'm just asking. Your monitor is either not turned on or it's done broken.
Okay. Linkage meeting from November. Is that right?
You're free.
No, that's consent. Public comment now.
Yeah, we have free. Now you're to your patrons.
No, I'm
Three.
three.
You're
Sorry.
three.
Oh, I can read this one. Okay. So we are. Okay.
You're way.
Three.
If you're using paper, you're way past that.
Well, I'm going to the paper, but I'm a little here.
Okay.
Hey, I made it.
There we go. Glad
Turn
you're
it back
here.
off, jeez. Okay. Concerns of Burlington USD 244 patrons. I have one right now. Is there anybody else that's signed up? I don't think that's it. Beth Lord, you have 5 minutes.
Okay, so my name is Beth Sawyer. I have a senior at Burlington High School. I think I know everyone in the room in one way, shape, or form. So I've been told that I'm chatty and that sometimes I'm emotional, so I have my stuff written out, and I'll try to stick to it the best I can. My son is a member of the boys basketball team. On December 4th, the entire team was quarantined. Although the absentee rate doesn't reflect for all of those in quarantine, I've heard that the halls felt rather empty. Throughout the full week, Braden attended classes. His teachers had to log him in. It wasn't the ideal situation, but he was at least allowed to participate. I commend the teachers and the technology staff for allowing that to happen, because he did feel like he was part of the classroom the best that he could at that time. I'm sure it was a nightmare for the teachers to juggle both remote learners as well as tending to the needs within the classroom, and I understood as it went along why the need to consider going to remote learning became an option. Academically, I'm not as concerned about Braden as I am his social and emotional health. The concern I'm bringing before the board is a decision by administrators to suspend all BHS activities, in particular the boys' basketball practices and games, without consideration of every single program or activity circumstances. To my knowledge, there is currently only one program that are under local restrictions. I was notified by administration that everyone that was involved in this decision was in complete agreement in the decision. However, the board would get to ultimately decide. It was also included that the board may not agree with the decision that was made and has the opportunity to change moving forward. I'm sure you're going to hear later about details to that. that. But my concern was going remote learning. You can learn remotely, but I don't feel like activities and athletics can be done remotely. Things that I would like, I'm here tonight in hopes that moving forward, consideration to a plan to consider activities even though remote learning is taking place would be reviewed. The boys team, things that I would like for you to consider, the boys team was quarantined until 7 a.m. this morning. There have been some that were released early because they took tests. There are some that are quarantined longer, but as the entire team has been cleared by local health professionals. This team wasn't around family, they weren't around friends, they weren't around their team for the last 10 days. According to guidelines, they are potentially the safest kids to be practicing. Since last summer, our entire family has made changes to protect our loved ones the best that we can, knowing the entire time that we were allowing Braden to participate in things that he chooses to do. A responsibility that we took seriously and we accepted. When basketball was suspended, we were completely blindsided. The boys had done their part. And there was absolutely no benefit for what they did. By allowing school-sponsored activities, games, and practices to resume, it lets the school set the guidelines and precautions, ensuring that the children will be in the safest gathering. Just as important that all kids that are on the team are included. Kids are going to gather. Today, kids were at the rec center, kids were at restaurants. I'm pretty sure the entire teams were included. It just depended on who called you or who invited you to go do that. Although the kids can attend classes remotely, they cannot participate in school sports or activities remotely. For years, we've had the belief that keeping kids engaged and involved in activities is the best thing for them, and I'm curious why that has been disregarded. An argument can be made now more than ever that high school students need to be included and involved in structured school activities in a responsible way. So tonight, I am respectfully urging the board to reconsider their support of suspending all high school activities, in particular boys basketball. At a very minimum, please allow them to practice. I appreciate you listening. Thank you.
Thank you, Beth. Communications. So we have some communications.
Those are in your packet, but in case you wanted to see them.
We have some thank yous. I think you probably were on that.
There for the staff appreciation jackets. Very, very well received, and many people like them a lot.
Administrative reports. Barb?
No changes, any questions for me?
I do not have any. Anybody have any questions for Darla? Okay. Middle school, Matt?
He is not here tonight because we've got middle school music program going on, so he may be here in a little bit.
Okay.
Or what's going on?
Middle school music program.
Okay, so high school? Okay. Yes, ma'am. You got anything first?
So, unless you guys have questions?
Lindsay, no. Okay. Anybody have anything, Lindsay? Be short, me. Doug here? Short. Doug has nothing. Anybody have anything for Doug?
If you have any questions, either for Doug or Matt, I sure can relay that and share that with you on my Friday emails to you guys, so let me know, please.
I guess my question is well, I know that we shut down the school, so the technology stuff is starting tomorrow.
Yes, remote learning
So
tomorrow.
we're all ready for that then?
We are. We have shared with the public the sites that you can get access to internet throughout the county. I've connected with Darren Doherty at the library. There could be some people coming to the library. We've talked to the rec center. I visited with Scott Jeffers. There could be some people at the rec center. We will know more tomorrow. We'll be in touch and figure out all the things that could be possible roadblocks that we need to work on. And staff's ready. I've been in the building. They're doing quite well. Matter of fact, a lot of them have already been in remote learning scenarios before.
Okay, thank you.
Mm-hmm.
Superintendent's report, Craig.
Okay, just a reminder for the linkage meeting for graduates. That'll be January 4th. That's at 5:45. We have that instead of being on the same day as the regularly scheduled board meeting, because some of our graduates may be heading back. So we do that the week early. So January 4th is when we do the linkage with our graduates. Absolutely awesome news with the Jones Trust grant. We wrote a grant for $325,000 for our community daycare project, and it was funded. I was a little bit pessimistic as time was ticking, and we didn't get any news from the grant committee. But finally, it was the day after Thanksgiving, so it was kind of, I guess, poetic justice there. Thanksgiving came a day late, but anyway, we're very excited. This will allow us, to have this project that will allow us to meet the needs in our area with daycare is so vitally important. Early learning is just, again, so important, and we have such a lack of daycare in our community. And again, we do have some local donors there that helped us with this grant, as well as, of course, the Jones Trust with a couple of great donations there. So we're very, very excited to get this going. We are hopeful that we can have this maybe going on June 1. A lot's going to depend on the work that needs to be done and the timeliness of us getting it done. We will be moving forward to look to hire a daycare director. And so very, very exciting news. So yes, I don't know if you have any questions.
Is this a renewable grant in any way?
It is not. It is not. This is money that we allowed, basically for the grant, we wrote it for initial startup costs and fees to start up, to pay for the director's salary, to pay for renovations to the building, to pay potentially for stipends for enrollment for certain for families that may need some help with with some fees and so on and so forth. So this is not renewable. But there are other grants that we may look at if needed. We do believe that daycare, again, will be budget neutral and self-sufficient, with fees coming in, us paying out salaries. This initial money, though, helps us to get started. It is just absolutely a dream come true, and prayers answered. So, yeah, good question. Other questions?
Anybody else have any questions? So I assume we've had a discussion again. I know we did early on with the other daycare providers and let them know
Yes.
that we've got approved of this.
I kept them informed of this whole process. They are very excited. Again, like we mentioned before, you thought maybe they might be fearful that we were trying to run them out of business. They hate that the people, they're happy that we're doing this project. They hate it when they get people on their doorstep and say, please take my kid, please take my kid. And if they take the kid, the daycare providers go over their allotment and they run the risk of being sanctioned by their inspectors. If they turn the kids away, they leave parents in tears. So there's just such a need for the daycare. And with COVID happening, we anticipate there maybe could be some more babies happening in the community, because there's some idle time there during March, April, and May with people not being able to work. So who knows what kind of numbers we'll have, especially with little ones. So anyway, this has a great potential to help out not only our school system, but also our local businesses. James and Stacy were on our daycare community advisory group. This has, like I said, great potential to just be a real big game changer for us.
Have any of the daycares mentioned that they may or may not function anymore because of COVID and all of that?
There are some people considering, because again, there are some people that are a little bit older. They may decide to, retire. So yes, there's the possibility that they may not continue on with their daycares in the future. So yes, it's possible. We did make sure that we told them we want to work with them. We want to help them with trainings, for example, like first aid training and different potential curriculum type work that we're going to do with our kids in our daycare. We want to be able to help support them with that work, much in the way that we did with the grant that Darla worked on for Mobilizing literacy, thank you. Mobilizing literacy and the assistance that we have with Amanda Briggs and our local daycare providers, Trinity Lutheran and Rainbows. So we want to work with them, and we need them to survive and do well and thrive, because we can't provide all the spots needed. We need them to do well. We need us to fill a void that's there, and then also them to do well and prosper. I shared with you some pictures, I think, up here in regards to the concession stand restroom project. I think Tracy might be looking to pull those up. Again, that project is coming along just absolutely awesome. We have had no change orders, absolutely zero change orders so far. This is going to be a wonderful facility for the community, much needed to kind of accent our complex of our baseball, softball fields, as well as the football stadium and the track. They are approximately 75% done. They've got sheet metal that's been delayed due to COVID and factory issues. They've had a few other materials that have been delayed, but overall, again, it's coming along very, very nicely. That's a picture from inside where the concession stand would be. Those two windows are kind of one's facing north and one's facing west towards the softball field. So there's two windows for people to come. This is a storage room area that the rec center really, really liked on this project, as well as us. It allows us to store things in there. Our dugout storage in both baseball and softball is just inadequate. Plus, it's also very, it's very tiny. Sometimes it gets a little wet in there. This will help the rec center to be able to have storage areas for their equipment during the summer for baseball, softball, t-ball, so on and so forth. And I think you can kind of see the picture of the sheetrock being done in there, insulation. There's a referee's room, an official's room there. I always didn't like it. I never did like it that our officials were changing between games out in the parking lot. I just didn't think that was very positive. We all felt that was going to be a potential problem for people that might not be happy with their calls, so they will have a place to change separate, a safe location. So anyway, and we can also, like I say, use this for officials during the football season as well. Again, project is coming along right on schedule, or actually a little bit behind schedule, but nothing. It'll still be prepared and ready to go in time for our fall seasons, or actually our spring seasons. Right on budget, maybe even a little under. I say that, and now I'm going to knock on wood. We will see. So right now, I can say right on schedule, or it should be right on budget, maybe even a little under is hopeful. And we'll know more soon. I think you guys will be very proud of the facility as well as the community. And again, a reminder, $100,000. We got donated $20,000 a year for 5 years from the rec center, $100,000 from another Jones Trust grant. I'm going to send them a very big thank you card, because they have been great to provide $100,000 towards this project, $50,000 towards our daycare playground, and $325,000. They are tremendous to support this area with a lot of different things. So, anyway. Okay, any other questions? Restroom, concession stand facility? Okay, the last item on my report, I put this in the report on Wednesday, and we send the board packet out on Wednesday. And little did we know things would change in our world, in regards to remote learning. A week before this report went out, our high school attendance scenario was terrific. We had 1 or 2 staff member illnesses. We had a very small percentage of absences. And then a week later, things changed. We had 6%, 7%, 8% absence rate at the high school. We got to the point where Stacy, Reed, Dave Watkins, myself, Lori Herman, we started to talk. We started to see the trend line not going well. That's when we felt like we all agreed that remote learning was a must, because we were seeing numbers that were going in the wrong direction. We were just very concerned about the health safety of the whole building. We were seeing illnesses, not just COVID, some strep throat popping up, also rhinovirus, other things like those issues, health issues. It just happened this time of year, cold and flu season, things pop up. Ultimately, we made the decision to go remote. We just felt like it was a needed choice. I've kind of shared with you guys all along that I think like Wednesday, if I'm not mistaken, or Tuesday, I mentioned to you guys via email, we just were seeing a trend line that wasn't good, and this could be a possibility. So anyway, after we made that hard decision, told all administrators, directors that were involved in discussing this topic, I said we're going to wait till tomorrow, meaning Friday, to discuss activities. So, as you can tell in my report here, my initial thoughts were, if you're on site, you're having activities. If you're hybrid, you're probably having activities, maybe not. It just kind of depends on a lot of different things. And if you're remote, my initial thought was no, because again, what people were saying is if you're remote, if you're not having school on site, it's not safe to have school on site, so therefore it's probably not safe to have activities as well. So having said that, I can tell you my original thoughts, they changed because I did survey my local, or excuse me, my statewide companions and colleagues. And I think if you look up there, I've got a remote learning and activities document. I asked them basically, okay, if you're in remote learning, tell me, are you continuing to have activities or are you not having activities? And if so, tell me the reasoning behind whichever one you're doing. So having said that, this was a document people shared with me. Again, not everybody responds, but you can see that quite a few people did, and various sizes of school districts. And you can see it's pretty much a 50-50 split. So again, these are the people that responded. These are the ones that said yes. These are the ones that said no. It's a mixed bag. So then I asked them to elaborate. So then when I asked them to elaborate, the ones that said yes, we're still having, or no, we're having activities, said the exact same thing I mentioned to you before. If you're not able to be on site, you shouldn't be doing activities, because if you can't have school on site, you shouldn't have activities. If it's not safe to be there learning, you shouldn't be doing activities on site. Those were the people, the boards, the superintendents, the different discussions that had occurred. The ones that said yes, they brought up something I hadn't really even thought about a whole lot. They said, what happens if you have adults? Let's say your absence rate for students was like 1%, 2%, whatever the case might be. Well, your adults, if you lost, let's say, 20 staff members for illness, well, you're shutting down a program or programs because of your adults. Well, that doesn't seem fair. And in my mind, I thought, you know what, you're right, that's the case. So having said that, in my mind, that was something you needed to consider, the adults. So then when we looked at the attendance piece, when we met Friday, the reason that, we had some staff illness, but we didn't have to go remote because of the staff illness so much. It was the kids' illnesses that we were seeing, 6%, 7%, 8%. And we were told that 10%, the health department, or excuse me, the health officer would be looking to shut us down if we got to 10%. So, having said that, we just felt like we needed to do what we had to do to keep everybody as safe as possible. At the time, we had 2 teams quarantined. We considered all programs as a whole, and we also considered the boys' basketball program individually and separately because they were in quarantine. So again, and everybody was involved in that decision. Stacy Reed, Dave Watkins, Lori Herman, myself, Doug Vanderlyn, and we were all in discussion with this, and we could fight it both ways. We could probably fight both sides of the argument and win both sides of the argument. The bottom line, when we got down to the final call, and it ended up, again, it's my call, it's my recommendation. I just had to do what I thought was best for the health safety of everybody. I don't want kids to be quarantined. I don't want families to be quarantined over Christmas break. We had an increase in students. The absence piece, we had issues with a number of kids that were COVID pending tests. It just wasn't a good situation with our numbers. So, having said that, I don't know if you have questions in regards to what we decided to do, the choices that were made. I can tell you it wasn't easy. This is no fun at all. But you sometimes have to make decisions with the emotion taken out of it, and you have to do what you feel like is best for everybody in regards to that health safety. So, question.
So, is this 10% and the county's going to shut us down? Is that something that has always existed? Or what is that?
Well, 10% in regards to where we were seeing illnesses pop up.
Right, so
For
if 10% of
for
our,
a building, for a
if our
building.
10% of a single building
Mhm,
is sick,
mhm.
the county is gonna shut down the school.
Lori Herman indicated that was a conversation that she had
Is
with
that a fact?
our
Do you
chief
know
health
that, Matt?
officer, Dr. Sloyer.
It's not a policy.
It's not a policy? So how many of these illnesses, what I want to know, how many of these illnesses were quarantined kids and how many were actual sick kids?
And these are illnesses of kids that were sick.
So-
Not quarantine. These are not quarantine
Quarantine kids don't
numbers.
count as absent.
Quarantine are not ill or not sick, because again, they
Right.
may be fine, they may be exposed. But,
Right.
but they may or may not be ill.
So these were documented illnesses, and then we had, so what was the number of documented illnesses that were in our school, in the high school?
I had 22, if I remember correctly.
22 kids,
22 kids.
and that's,
And there could be more.
well, I'm sure there could be.
Because again, we don't know, unless the people let us know in the quarantine, they may or may not let us know if their kids are becoming symptomatic or not. They may or they may not let us know if they are positive or not. We just don't always know
But these
that.
were all unknown illnesses, could have been COVID, could have been rhinovirus. I know it's not been
Strep throat.
influenza A or B because there's no cases of influenza A or B in the county.
Could have been strep throat. We had strep throat. We had flu-like symptoms. We had rhinovirus, COVID. So yes.
So I guess I'm at a little bit of a loss as to why we went, to me that's, so the number of kids not in school was significantly more than that.
Correct.
Because of the boys' basketball team, then right shortly behind that, the girls' basketball team, which
And other quarantine
unfortunately
students.
isn't a big number, but.
And other quarantine students that were involved. Could be band, could be others. Could be just
Right, but the
kids,
big numbers
kids
were
that aren't
just
even in
2
activities.
teams.
Mhm.
And people in band, so how many people were quarantined at that exact time?
I don't know exactly the
That
numbers.
we didn't know.
We scored 80 and we were coming up
80 were quarantined.
between 75
And Monday, how many came out of quarantine?
and 31.
31. So there's still 40-some kids in quarantine.
And there probably would have been more because we hadn't gotten to the girls' basketball team.
And we had a few more positives that popped up over the weekend.
We had a number of kids that were COVID pending tests. I know of 2 or 3 those COVID pending tests ended up being positive. I know of 1 or 2 that their tests ended up being negative. But again, those kids, even if their tests are negative, they still were ill. So that was the concern. The numbers for us, and again, Stacy, Dave, Lori, and myself, we all agreed that it was not going in the right direction. We didn't like what we were seeing.
So I don't know that I disagree with the concept of going remote. You know, it's so close to being on Christmas vacation that, you know, it adds kind of a little bit of a buffer to the whole process. The part of the process that's getting hard that a lot of people are seeing that is part of the emotion of all of it is that they're seeing all these kids' emotional and mental health deteriorating from the whole process. So, you know, the problem I have with all this is that even my profession is not following the science of this disease. And I have a really hard problem with that we don't do anything that scientifically has been shown to be beneficial. Nothing. So the only thing that probably will help is the vaccination, which that's still up in the air. But masks have not shown to stop the disease or prevent the disease in any way. There's no scientific paper that says it, and none in the works that predict it. We have not been able to prevent the spread of it in any way whatsoever. It's ubiquitous, and it's going to be here. Everybody's afraid of this because science, medicine, has scared the living crap out of everybody. There's a lot of people dying from it. There's a lot of people, the number that I'm interested in is what makes influenza so less critical because 60,000 people a year die from that. Nobody gets up in arms over 60,000 people. Where does the number become that we get so scared? Does it take 100,000 to scare people? 200,000, 300,000 where we're at now with COVID? There's lots of diseases out there that kill people that we don't do that process. But it's partly medicine's fault for not doing this. So then, if you go through the studies and you look, it's the people 60 years in age and above that really need to be protected. That group of people need to avoid contact or getting that disease because those are the people at highest risk. Less than that age, can people die from it? Yes. But people less than that age die for all kinds of reasons. And statistically, it's not the number one killer of anything less than 60 years of age. So then that brings up the concept, should you let your kids play and do things with the risk of getting COVID, knowing that they personally are probably not going to have anything but the sniffles? And is it the people in the stands that we should protect and the people that want to come? Well, the concept of keeping only the parents there who are exposed to those kids anyway is a decent concept, and not letting grandma and grandpa come into the building makes sense. So I have a hard time with the whole process of stopping everything. It is reasonable that we went to remote learning. Hopefully connectivity and all of those types of media things aren't going to be an issue. I personally would like to see kids still play. My opinion, based on everything I just said, I would still like to see the kids playing because they have done what we've asked them to do, and their risk is the lowest. That's just my opinion.
I don't know if Dave or Stacy want to speak here real quick. I will say this, I have not had an email, a phone call, a visit, upset that we went to remote learning at the high school. Talked with Lori Herman today. I asked her, did you hear anything over the last few days? She said no. She goes, I think everybody was seeing our trend lines at the high school. Kids were ill. I even had some people send me some emails about their kids. They were trying not to be sick. As far as they didn't want to share being sick because they were afraid they were going to let down their teammates. They were fighting like heck to not go either get tested or they didn't want to show that they were ill. I had some people say that was happening, and I don't know if you guys have had others as well.
I have a few things to say to add to Shay's. What you just said, kids afraid to say that they're sick. Well then, somebody is failing somewhere not to tell these kids that it's okay if you're sick. Stay home. Don't try to cover it up. I mean, that's what exotic animals do till they die. They cover it up. They mask their effects. So somehow or another, administrators and teachers got to get this through to the kids. If they're sick, stay home. And that's with anything. I go a step farther. I don't know as I agree with going remote with the schools, because I'm more of a herd immunologist, epidemiologist, than I am trying to run from it. What percent of kids were sick with influenza in years past? I think I can remember at one time, a couple years ago, we had over 30% of the high school out from the flu. Correct me if I'm wrong.
Not since I've been here. Not since I've been here.
No, we've had those times.
Pretty high ones last year.
It's hit us hard, but we never thought about going remote. I don't know how many of you actually have taken the time to visit with board-certified pathologists or epidemiologists or immunologists, but I've spent a lot of time with these professional people at different universities over the last couple of months. And one of the first things that they tell me is they don't know everything about COVID, but what they do know is it's very, very infectious, and that we're not going to stop its spread. And we're not gonna stop it by shutting things down. It's just gonna have to get through our population. Their comments about mask can help some if they're worn correctly. I guarantee you 95% of people wearing masks are not wearing them correctly. Because if they're worn correctly, they've got to be so tight to your face to avoid any particles coming out and any particles coming in. They're not effective. And in fact, they can at times make things worse. One of the pathologists told me the biggest cause of spread is simply hand-to-mouth, the nose contact when you touch surfaces. And some people, if you watch them wearing masks, they're constantly touching their face, moving it and stuff like that. I mean, nobody's an expert on this, but I just feel like Shane said, people that are older, people that are immunocompromised, pre-existing conditions, they need to take some of the responsibility themselves to protect themselves. And if they want to wear a mask, if they want to stay home, if they want to isolate, they probably should. And it's too bad grandmas and grandpas can't come watch their kids. But I don't want to be the one that stops them. If they want to take that risk, basically that's what this is all about, is risk. And I just don't, even though I'm concerned about it, I don't think that our risks are high enough to the extent of things that we've gone to. People die every day. It's just, we die. I don't know. Anybody have anything to add to what I'm saying?
I don't know. Lindsay, go ahead if you.
Well, I mean, you guys know that I'm a COVID survivor, and I had pre-existing conditions, and I got pretty bad, to be really honest with you, and hospitalized, but could have been worse. I have no clue where I got it. I agree with a lot of that. There's no real true knowledge of a lot of that stuff. But I think the same token as we heard our kids, even though we went remote, they're gathering, people are gathering, we're going into holiday season, so that means that even if they don't get sick, other people, they now come around, because I'm sure our families are going to get together for the holidays, could be infected. And I'll tell you, that was my biggest fear all along with my parents, all along. But I really, in terms of the conversation that's on the floor right now, in terms of participation, I just want to clarify, because Keisha has had several meetings, and one of them, they lengthened the moratorium. So that moratorium, you might have to correct me if I'm wrong, does that start next week, next Wednesday?
Starts on the 23rd. It runs through January.
23rd to the 4th.
To the
January
To the
3rd,
3rd.
yeah.
To the 3rd.
Third, you can start on the 4th. So I just wanted to clarify that part of that's out of, we're really talking
Right.
this week.
We're talking about.
And I'll let Dave and Stacy speak if you guys want to talk about the event rescheduling and things like that, or anything else.
I can just speak to when the decision was made. It put me in a situation where, number one, I had to let who we're playing know that we're not going to be playing. Rescheduled. We have lost no games. All games have been rescheduled. Wrestling is still in the works because that fluctuates daily. And so does everything. Today there were 14 different schools looking for games for either tomorrow or Friday. So it's out there. Everyone's dealing with it. But under the circumstance, because it's more than just roll out a ball, you've got to change officials, you've got to change locations, you've got to get workers. There's so many different pieces that we had to make that move. So the Iowa and the Wellsville game have been rescheduled. They'll be in January. So that's part of where we stand in terms of competitions. Right? Those had to be rescheduled, and we got that done.
And I'll mention too, I said, you have to weigh not only the kids' situation, but we have adults in our building that have health compromised issues. The trend line was going in the wrong direction. I've got to be very careful of not only our kids, but our staff. I've got to look out for everybody. And our students and our staff are the most important things for us. Having said that, I didn't want anybody to go into a break with COVID positive or potential quarantine situations. We had made at this point excellent. We just saw some things going in the wrong direction. I felt like sometimes I have to protect not only our students, but our staff. And I gotta take the emotion out of it. I talked to some basketball parents, and I know they have some thoughts here, and I understand. We did consider basketball separately, boys basketball, we did. We chose to go this direction. It was agreed upon by all of us. We still feel the same way. After I talked to parents this weekend, talked to Dave and Stacy 2 separate times, both on Saturday and Sunday, we did not waver or change our thoughts. And again, if you guys decide to allow the practices to happen, that's fine. You can do that. It's not our recommendation to do so. For 3 or 4 days, maybe 5 days of practice, that's what they're missing, potentially. Now, the decision that we decided to make, final decision is mine, to share with you guys on what's decided. You could change it. If you change it and something bad happens, we have COVID positives, we have kids that are quarantined, families, there's nothing good about that whatsoever. If we leave the decision as is, it doesn't really, again, it's not going to look negatively.
Yeah, but that's gonna.
In the final
happen when we go back
situation.
to school January 4th too, right? I mean, if you say we're going back to school
It
January
could.
4th,
It
then
could.
kids get sick or staff gets
Mhm.
sick. I mean, you can't
It could.
say,
You're right. But based on the information right here and right now, what we had, I felt like it was the right decision for the health, safety of not only our students, but our staff. And again, if I'm going to err on the side of something, I'm going to err on the side of caution. And that's the way we felt.
I would just echo what he was saying about, I was very concerned about staff at that point in time. Because we do have those 60-year-olds that are in our building. And I believe that I have to look and err on the side of caution as well with our staff.
so what are our thoughts about January then? After
I think
everyone's
that's
out for Christmas
to
and
be
everything?
determined.
I mean, if you're saying you're concerned about the staff and you don't wanna have kids back in the building,
No, I
then
didn't
what's
say.
gonna happen?
A lot's going to depend on what we see in the next 2-3 weeks over Christmas break. So, I mean,
Right.
We were
I
just
don't have a
talking
crystal
about
ball.
kids that were coming up with COVID.
mhm.
That
Right.
would be, in those last 2 days, we had a
So that's
large
why
number.
the
that had that.
practices that you're saying and the games, those might not even happen, right?
Well, we're hopeful that they do. I mean,
Starting-
that everything we're hopeful about is that, I mean, I never wanted to go remote to begin with, which I've told you guys that from the word go, but I think erring on the side of caution with the number of staff, those were all the factors that went in, plus a lot of other factors, but we talked, and we came up with a decision that we felt like was, workable. And it was discussed out pretty hard, because everybody had their own opinions on it.
Correct.
Monique, you have anything to add? Is that a no?
I don't have anything to add.
Okay. Lucas?
I had a couple points or thoughts or whatever. First thought I have is that I'm not in buildings, and I want to trust the administrator, the guys that are in the buildings and gals that make the decision to go remote. If thoughts are about staff or students, I agree with that. Protect everybody. Try to get the education in the best way possible in a bad time, I guess. But then on the same point, when it talks to activities, I have a hard time. You can go take a test at the school because that might be too dangerous, but you can go play sports. I understand they're different, but I'm here to try to, ensure that we get the best education, both emotionally, books, everything for our kids, and it all wraps up together. The sports are very important to me. And I try to people make a decision about remote learning for a reason. And I also feel that if our schools and our staff don't feel safe enough to be in the school, then that should all across the board activities do. And it stinks, I don't like it, but I think that's where we are. And I like this inside.
Thank you. Stacy?
I don't really have a lot to add other than no matter which way you go, there will be somebody that's upset with whatever decision is made. And I do have strong opinions one way versus another, but
There's no reason to necessarily get into that today. But no matter what decision, you can argue either way. But the administrators that are in the buildings, I feel like made the best decision that they could with as much information as they had, and I do trust that decision that was made, and I support it.
Thank you. So, thank you. I will say that, I'll just make the statement right here. I'm not in favor of mandating masks out in the general public. I'm not one of those fans to follow the governor's mandate, but I do think as a school board member, we do have some responsibilities to kids. We have some responsibility to kids, not only kids, but we also have to the staff. Now, with that being said, I agree exactly with what Lucas was saying, is we hired these administrators for a reason, and our reason is that they need to make these decisions. They're on the ground floor. They're at the battlefield fighting that battle every day. We're not. We're just out here having to have them give us the feedback, and if they are doing something that's just absolutely out there, then it's time for us to step in and say no. I don't think that right now at this point that they've done that. I think they've made some hard decisions that are just absolutely. We have those discussions every day at the hospital. We have hard decisions at the hospital we have to make. Unfortunately, it's not easy for anybody, and everybody's going to suffer. So what Mike talked about the 60, I am one of those greater than 60-year-olds. So I'm concerned about staff that is greater than 60 at the high school, that all of a sudden we have all these kids are starting to get COVID and passing to these. What are we supposed to do? Lay all those people that are over 60, they need to go home because they're supposed to fend for themselves. Well, we have a responsibility to fend for them also. So they can't just go home. We've got to hire some other staff. So I think I have a little problem with that. So with that being said, I support what the administrators have decided.
Well, I kind of agree with what you say too. Also, James, I had a kid that was exposed in my house. I wasn't going to kick him out of the house for being exposed, or I wasn't going to leave my house. But I didn't get COVID from him. This decision was made by the administrators. The board had nothing to do with it. And I hope that we don't end up circumventing our administrators on athletics, because that's not right. I don't want to be put in that position. You know, they made the decision because they thought it was best. And I will say, and I don't like it, but going remote is somewhat similar to a snow day. If you call school because of the snow day, we don't go and have a basketball game that same day. So it stinks, just like Lucy said. That it's our administrator's decision. We're not going to micromanage.
And I will say this, that we would be bringing a different proposal to you if, like we said, if the staff scenario, we couldn't have school because of the staff being ill. And our student attendance was like 1% absence rate, 2% absence rate. As long as our coaches were healthy and our kids were healthy, we'd be bringing a different proposal to you for continuing activities. COVID is not a one-size-fits-all decision. You've got to constantly evaluate and reevaluate everything that we're dealing with and choices. And again, so again, like I say, my original thought was if we were remote, I shared that with you, we should be no activities. But my mind's been changed. This situation, though, was a kid illness concern. We were having, like I say, we just had too many kids going that were ill. And then that was going to jeopardize not only our kids, but also our staff. We have staff that are either elderly, health compromised, pregnant, whatever. We don't want any bad things to happen, if at all possible, preventable. And again, we don't know exactly what January is going to hold. We don't know. But based on the information we have right now, it was the right thing to do for not only the remote piece, but also for the activity piece, we felt like. So.
Thank you. I appreciate the parents providing feedback or calling us with that, because I had a nice conversation with Beth Lawyer, and I thought she had some really valid points. And then, and I weighed it, and weighed heavily on it over the weekend, and I talked to Greg a little bit about it, and I was like, and then I'm a little bit, what Mike said, we've shut down school, and then so we just say, well, let's just go ahead and have sports. And so I think we're just kind of not playing on the same playing field there. And then unfortunately I said, it sucks for everybody. I mean, somebody's just, we're just going to have to move forward. And then, the one thing this will do, as I said, number one, it probably gives us a reset. I just say, okay, let's reset, come back to school at the first of 2021, and let's have a new year and look harder at the decision next time when we have to do it. If we have to do it, that maybe we have some things like Beth talked about, some other things. We think about all of those things, but I still say it's really on the administrators that they need to do it. So
I will say the decision was not taken lightly at all.
I do have.
Yes, Monique.
Go ahead.
Okay. I do want to say thank you and recognize our administrators for working their hardest to try to reschedule everything. I know that's not easy, and I do appreciate that you will do everything to try to get those events rescheduled. That was one thing, I think is really important. Even though we don't get to do it this week, it is our best intention, I believe, and administration, from what I was told, that you're working really hard to reschedule all of those, and I really appreciate that.
I think you guys know us well enough that there isn't anybody in here that wanted to go remote worse than I did. There wasn't. And I even told the staff, I said, you guys know how competitive I am. And my competitive juices were flowing because I didn't want to go. But I also knew what was in the right mindset, and a lot of discussion and a lot of arguing, just so you know, between staff, and I'm talking about administrative staff. We argue, but when we make a decision, we move on. We know that's, but there is tremendous amount of discussion and we open the air in there, and we go after it, and we talk about what's best, what's not best, and what we think's right, what we think's wrong. And I wanted to say, I think my big thing has been trying to make sure everything is as normal as I can possibly get it for these kids. And that's what I've tried to do from day one. I will continue to do that. I want their games, I want all of that as much as I possibly can. And I think that's been shown with volleyball, football, all of those sports. The worst thing that's going on at that school right now is the club organizations are not able to do what because there's a lot of schools, most of our schools are not doing those. But everything else is kind of hovered along, and then all of a sudden it just hit. And so there had to be some decisions made. And I appreciate your guys' comments about thinking that, we've thought these through quite a bit. So I do appreciate that.
Good.
Well, and I think you guys should be commended with how far we have made it, because many districts have had these hard conversations weeks, if not months, before we've had to. So you guys have done something right, and I really appreciate everything that you've put into this year so far, keeping it as normal as you can for our kids. You guys have done a tremendous job.
And I think the kids have done a tremendous job. I think the staff has done a tremendous job. It's just, I think things just started to kind of snowball. And like someone said a while ago, just make it a reset. Here will be what needs to occur, and we can move forward. And, I'm very optimistic, I guess, that things are going to get cut and things are going to go fine.
And I want to commend the two parents that spoke to me in regards to the boys basketball. I had two parents that talked to me. I appreciate them talking to me and asking me questions, and not going public like with a social media campaign that's anti this, anti that, whatever. I appreciate people talking to me. At the end, we may agree to disagree, and if somebody is sitting in my chair, they may feel differently if they have to sit in that chair. And if I'm sitting in their chair as a parent, I might feel differently too, because I had kids that played sports, both college athletes. I get it. But again, I appreciate them talking to me. People, it's tremendous when a conversation is carried on in an adult manner, and you can talk about things. So commend those people that contacted me. Thank you.
Okay. Thank you. Okay.
And that's it. I don't have anything else on my report.
Okay.
Can I add just a couple things?
Sure.
I need to speak to what Selena said as we look at January and going forward. There are a few tweaks that we could make within the two buildings that we've had significant quarantining with that might keep more kids out. So going forward, if like practices, we could do, as long as kids are either distance or time limited, if the drills are shorter than the 10 minutes, that could, I mean, if we have very strict adherence to that, or if they're in masks, if they're not being physical and sprinting, we might be able to cut down some of the quarantine. The lunch tables in the high school were somewhat of an issue, and so if we can just add 4 more inches to those, we can get there. I mean, a pool noodle was an idea myself. Let's just put a pool noodle around the sides of it. I don't know. But if we wouldn't have to quarantine as many kids. So there are just a few tweaks that going forward, if we could work some of that out, that would be great. I know that the elementary school had made some changes with seating charts and stuff like that. So that was amazing, and that will help going forward. So that will be helpful. And weightlifting, if we could keep kids, the same group together at each station, that would be helpful. And those are just little things that we've experienced that have increased our numbers when we could potentially decrease them a little bit. So
It just amazes me at how every school is different. We had a positive case, and Holton shuts their whole team down. Shuts them down. And this kid didn't even play against all those kids, by any means. So what we are seeing is a difference in philosophy from different counties all the way through. And I don't disagree with Lindsay at all. There's little things that I think we can do with the teams, some things like that. There's some things that our school we have some rooms that are just not big enough, where we're doing everything we can and they're distanced. But we really started with the basketball team. That was 31 kids at boom, just like that. That's what happened. It wasn't the lunchroom or this or that. It was one group that started that, and then we had little things that started to pop up as we went. Up until that point in time, we had not had that.
And I think what's unique is each local health officer gets to make that decision. And so, when Jeff and I talk about here's what we're seeing, here's the interviews we've done, we really try to take that information and give it to Dr. Sawyer, and so he can make the best one that he can. But with basketball, when kids were exposed 5 days in a row, and you don't know who is with who, you just have to do what you have to do. But like if it's girls basketball and we know it's limited to 8-minute drills and it's limited to space and it's masked if you're not aggressively running, that's different. We might not have to pull every kid. So it just depends. I mean, it's just each case is different, and we try to make I know he tries to make the best decision that he can. So, but it's definitely a local rule when it comes to that, and we appreciate any and all information that you guys are gathering on your end. So just thank you guys for that.
And I can say I had to deal with 3 different counties, and 3 different counties were different, and all of that. So
How many of the boys ended up positive?
I don't know if that.
I think there's
exactly.
We were told 1.
Well, there's more than one. I know that. But I don't know all of them.
But now you know what we deal with.
Yeah.
We were told that.
We really can't share information.
Well, you can't tell them names.
Yeah.
You say that there's 6.
Technically, we really shouldn't share even a count. I mean, we should not. So.
I can tell you, I've met with coaches, we are changing protocols within practice. Wrestling, we have just purchased, because some of the places we're going, such as Douglas County, you cannot step on a mat without being masked. So we have new masks ordered, so our wrestlers will be masked at all times in competition. Again, will it stop it? I don't know, but we'll take every precaution that we can.
Okay, thank you.
So what needs to be done with the lunch table? So back to that.
6 foot. It's 5'9".
Yeah. That's as big as it got.
It's just so the lunch tables are not long enough.
And when we bought new lunch tables 4 years ago, we bought the big ones.
We thought
They weren't big enough, I guess.
We thought of this, you have a little timer set for 8 minutes. Rotate! Or you step away, take a break.
They might like that.
That's
At the same way.
It's a technicality, but it would keep us from forfeiting the legislative
Okay.
Well, yeah, I just didn't know if there was something we could do to.
Board reports. Moving on to board reports. Questions? Huh? Anybody have anything they want to share? No, I only attended one session of the KSB board meeting last week, so too many other things. That's the unfortunate part about doing online stuff, and you're doing it in your office, you're guaranteed to be pulled away. Versus that's why it's nice to go away, and then you can't get pulled away, so unfortunately I didn't get to attend like I wanted to.
Some of them
I
might
did,
be. Go ahead.
Some of them are recorded.
alright,
Go ahead, Monique.
I'm sorry, little camera. I did see, I got an email that they're gonna do some coffee sessions, like December 18th is one, KSB, so I don't know. Craig, do you know anything about those, or? It appears it looks like it would be valuable.
Yeah, they sent
See that?
Yes, and I noticed one did get canceled today, so, or it's rescheduled. It's either canceled or rescheduled, I don't know. But they are trying to do some other options, via the Zoom type meeting, so. But yeah, I did see, I thought I saw that one got canceled though, Monique, so I'll have to do some checking and make
Okay.
sure.
That's all right. If they're to have some of those, I may try to attend some of those.
Anything else? Next discussion, district mask policy. I know we love to talk about this now. So I think all the board members at least received something email about, do you have it up there, the mask policy, or it just was a?
Well, it's just that one little.
We sent out something about that we felt as representatives of the school board and representatives that were making kids wear a mask, or making staff wear a mask, then we felt that the board should wear a mask also. And and again, that's one of them deals where I hate mandating masks, but we are representing the school, we're representing the kids and staff, and so we feel like anybody that comes into our buildings, same thing we do at the hospital. If a vendor comes in, they gotta wear a mask. They gotta be screened. And so, that was, a discussion was sent out. Does anybody have a discussion about that?
So I never got any of that.
I didn't get any of it either.
You did, that's,
It's in the book packet.
that was in your
You
board
said that,
packet?
yeah.
Yeah. You wanna hold up and discuss it?
It's in the board packet where?
It's 7A.
Yeah, there's
Jay,
nothing
while
there.
you're looking at that, could I say that
It's
Keisha
just
has
one
also,
Huh?
It's just one sentence.
One sentence,
And
yeah.
it just basically
'Cause I think that was-
He was
But
asking
I
when it
was
was
saying-
sent out.
District buildings.
Huh?
He was you're asking when it was sent out.
He sent out,
Yeah.
we sent out something.
He said he
that's
sent
what
something
he's
out.
asking.
We did, we sent out,
It would have been in
Friday
Friday
report.
So it would have been in my Friday reports that we would be discussing this at the December board meeting.
The only thing I
So-
got was
Thank you.
this motion that somebody's gonna make after we discuss it.
So basically, it's as simple as this. It says, face coverings will be required inside all district buildings. It's as simple as that. So whatever building you're in that's owned and operated by the district, and you are a member of the public, a member of the staff, a student, you must wear a face mask.
So do we have a problem in the school that the kids aren't wearing it?
I don't know.
Their overall.
Are your
school-
administrators not wearing it?
I'm gonna say overall.
Are your teachers not wearing it?
Overall in
we're doing the best
school.
we can.
Now-
So is this just a rule for Mike Thorpe?
It would probably be just a rule for Mike Thorpe, but it does apply to Mike Thorpe.
I mean,
And we do
so the
have,
reason I don't like a policy is then we have to have punishment if they don't do it.
Well,
What's the punishment?
there is no punishment for Mike if he doesn't wear a mask other than he can do it online.
So what's the punishment if a kid sits in his class, he gets tired of wearing it, takes it off for 3 minutes, and somebody has to yell at him to put it back on? That means he just violated our school policy.
Right.
And when they violate school policy, we have to do something about it.
And if they
What
come
would
to
you
our
like
office,
to
we
see?
do something with them, Shane.
So if kids,
No big detentions, or we try to have grace and kindness with kids. But,
Right, so-
but if they're belligerently or doing it because they're not supposed to be doing it.
but you're not having anybody do that.
No, we've had one or two, I'd say.
And so you've already dealt with them
We deal with them.
without a policy.
We just tell them that they've been asked to do this, and it's an unacceptable.
I think giving people a little bit more courtesy to do it, and I just don't agree with the policy.
I just point my nose. I've gotten to this habit right here, and the kids just, they're pulling it up.
And we can tell you, Kansas State High School Activities Association requires it now. Every event is required.
In the building.
In the building, the work enforced.
Yeah, and how are we going to enforce it?
Ask them to put it up, and if they don't, and it's repeatedly, ask them to leave.
And if they don't, we're calling the cops?
Correct.
And what's the law's right? I mean, I understand what you guys are doing. I'm pushing buttons for a reason.
Well,
And I think the buttons should be pushed. We should all understand that if we start making policies of something that truly is not effective, mask wearing is not. So making it a policy and then saying, now I have to punish the kid, I think our kids, and kids in almost every district, are doing a great job.
Yeah.
All the teachers are doing a great job. Nobody's coming out and saying nobody's doing this for whatever reason. The people that decide not to wear a mask, one, we can either avoid them if we believe they have COVID, so that's one thing. Anybody who doesn't have COVID can't give it to me. Right? So I don't care how many people wear masks, if you don't have it, you can't give it to me. So our assumption is everybody has COVID, and that's why everybody wants to wear a mask. But if you guys look at the science, all the particles, all the spray, there is no preventative mask on the planet unless you have a viral filter. And there are none unless you have a full face shield with a self-breathing apparatus that has an intact viral filter. It's the only way to do that.
I guess I would like, first of all, I'm going to go to my Friday notes, November 20th, item 8. We have some language from KASB for a policy stating everyone in our school buildings needs to wear a mask. We will have language to approve in our December 14th meeting. Once the pandemic is over, we will remove this item from our policy. Let me know if you have any questions. So I did share this with you on November 20th in my Friday notes. I will say this. This is highly controversial and very polarizing. But having said this, everything we are doing is limiting odds, limiting chances. We're trying to mitigate the scenarios so that we stay.
I understand all that, and I don't want to be condescended to. I really don't, because I know the science. So I don't want to be, I'm just telling you I disagree with the policy, that's it. I don't agree with the policy, that's all I'm trying to say.
Okay.
And I will tell you that one of my reasons for not wearing a mask is not necessarily that I'm defying your policy or your guideline. It goes much deeper for me. We're in a country where we have choices, and I really bow when I'm being told what to do from bureaucrats that have underlying agendas, and I feel like this is where this is going. If they can do this to us with masks, what can they do next? So I'm pushing back, and I think everybody, Beth's pushing back. I'm pushing back. I don't like this. I respect what the administrators are doing, but I'm still pushing back. And I think more people need to push back because this has gone too far. It just has. Look at the states like California where people are They can't go to church. They can't go to their restaurants. They're going broke. They don't know what to do. Well, that could just as easily be Kansas next week if people don't wake up and start pushing back. So, I agree with Shane. There's all kinds of information out there where masks can actually be detrimental, lower your PO2 level, raise your PCO2 level, actually make you more immunocompromised, touching your face when you got your mask on. So, I wear a mask, don't wear a mask because it's my choice and because I want people to know how I feel about it. And I think there's more people out there that don't like where this is going, but they're afraid to speak up. I'm not afraid. I'm not afraid.
Okay.
I'm concerned about the virus, but I'm not concerned enough to do what some of the things that have been done. Go
Okay,
ahead.
Lucas, go ahead.
I'm sitting at home in my basement as a courtesy to my colleagues on the board because I don't want to infect them with what I have. I see this more as a courtesy to the people around me, regardless of science, I feel like my talking could put particles into the air, whether it's bit or whatever, that might affect somebody that actually needs to sit beside right now at the board table. But I decided to stay home, and that's my choice. And that choice is also available to everybody else on the board to stay at home, not wear a mask, and still be part of the board meeting. And I think that's something that we can exercise in the same way and say, I don't want to wear this mask, but I still want to give people courtesy of trying to remove the possibility of me getting sick. And so that's what I'm doing sitting here in my basement, is trying to be courteous to people around me. And I feel like if the masks help, if you don't have a problem wearing them, wear it. If you do have a problem, don't. Social distance. Respect the rules of other people's property and their policies, and go about your day. It's not a matter of, it's a matter of choice, but it's also a matter of the choice of the district to try to protect everybody. So that's my 2 cents on it.
Thank you, Lucas. Monique, you have anything? Does that mean no?
I just feel like if we are expecting the staff to follow the mask, they should wear masks. They need to be respectful as elected officials that we have to do to wear a mask. It's 1 hour or 1 hour and 19 minutes before you like that we should wear a mask. I'm quarantined in my house because of the situation we're in right now. None of us like it. I don't personally like to wear a mask either, and I don't like to be bossed around either. I don't like to be told what to do. But I think it's respectful, and I think as elected officials that we represent, there's practices that we should follow.
Thank you, Monique.
Lucas, did you test positive?
Am I positive?
No, Lucas. Did you test positive, Lucas?
Yes, last Monday.
Okay. If I tested positive, or if I felt even the slightest bit sick, I guarantee you I would stay home. I wouldn't even go to my practice. I wouldn't expose my staff or my clients. I think I could make that decision.
So, Mike, I appreciate that. So I'm just going to add to this. So again, my statement stands that, I think we have a responsibility to the staff and students of the district as elected board members. I will tell you that Stacy can kind of testify through the hospital. We're seeing lots of people, no, Lindsay's here again, we're seeing lots of people that have had no symptoms. None got tested, were positive. None. So there were carriers. So, Mike, I appreciate the fact that if I feel sick, I'm going to stay home. I do that. We've had people that have been that way 3 or 4 days, were positive, stayed home, never got any symptoms, and continue to be positive. Those people are spreaders. I don't like it either. I don't like the governor mandating I got to wear a mask everywhere I do. But I feel like I do have a choice. If a business has a thing that says mask required, I can either go in that business or not go in that business. So it's my choice. The other thing is most masks, I appreciate what Shane says, but the reason we wear masks is so we don't spread. It's not so it doesn't come into us. It's so that we don't spread, so we don't cough and sneeze and do all that stuff all over the place. So that's the big deal, and everybody believes that the mask is protecting us from getting the virus. It's not. The mask is protecting you from me giving you the virus, exactly with those examples I just said.
So the information that I read, according to asymptomatic carriers, is that they are extremely unlikely to be shedding the virus. It just almost doesn't happen if they're an asymptomatic carrier.
Well,
I got that from some of the pathologists.
So the fact of the virus and the shedding is that we don't culture anybody who's positive. So the science shows us that day 0 is the time of symptoms. So from day 0 to -3 days to +8 days, an 11-day window, is where people can actually shed the virus. That's a fact that's growing in cultures, done with viral cultures. The problem is, how do you pick day 0, right? So unless you test somebody and then they test positive, you would have to culture them to see if they're shedding. Because if they're a non-symptom patient, day 0 could have been 8 days ago, which means they're currently not shedding at all. But they still get quarantined. The problem that people don't understand is that viral cultures are extremely hard and they're very expensive. So medicine hasn't spent the money on proving the cultures and the timeline. So if we could prove the timeline, because the mask does not prevent the particles from coming, it does not prevent it from coming out or going in. So if you have it and the mask, you can shed it or not. The key is who's shedding it. We don't have the science to prove that. So the mask, the reason the world of science has said wear one is a probability thing. So if I spit out 100 particles and the mask stops 50 of them, statistics says you would have 50% less risk of getting those particles. But it never is 100%. So it's never preventative. So I don't know if you guys look at me as just the button pusher, but I am a button pusher because science is failing us in that whole process. And unless we could culture every patient who's positive and then say, look, because after 8 days, up until 2 weeks after that, you can still get the protein. And PCRs, which is polymerase chain reactions, which is one of the best tests we have, actually can detect the protein produced by the virus when you're not shedding the virus. So you could be at day 15, you haven't been infected for 4 days, but that's the day you happen to get tested. It doesn't mean you're not shedding virus, but we don't have the data to prove that for anybody. So the result ends up being quarantine everybody who becomes positive, and if you've been within 6 feet for 10 minutes. I'm telling you, the virus doesn't care about time or distance. It does what it's going to do. It's ubiquitous. I understand you guys have rules you have to follow because we're in a school district. I just want you to know that I'm not an idiot and I have a lot of information that I think people should know. I don't think it should change the process. I think the school has done a good thing by having the kids just wear the mask and encourage them to wear it. I want you to understand I'm against a policy that, to me, if we have a policy, we have to enforce it. If we just ask kids, which they've all agreed to, how many, if you have 2 kids who are belligerent and don't follow masks, I bet you've had 2 kids that don't follow other things you tell too. I don't think it's just mask wearing that you get a couple kids here and there. I want you to understand that I'm not against the process of asking our kids to wear masks and encouraging them to wear them when they're down here like this. And you say this, and they put it back on. I'm not against that. And I don't think you guys have done anything wrong. I want you to understand, kids are suffering more than we give them credit for. And part of it is wearing this mask all the time. Giving them breaks outside, I think, is huge. The most exciting part of my kids' days is when they got to go outside to take their mask off. That's sad. It really is. Our world has changed. And I want you to understand that my arguments with policy is I don't want to punish kids for doing something that's an irritation for all of us. And I believe strictly that if we make something a policy, that we have to somehow enforce that. And I don't like that concept. It's not that you guys aren't enforcing it already. But nobody, I hope, is being mean about it. I just don't like it being a formal thing that our board is policy driven. All boards are policy driven. And it's always, well, they didn't follow policy, so whenever anybody gets in trouble, we look at the policy, this is your punishment for it. That's my biggest beef is with the word policy. Why can't we just ask the kids and the adults to wear the mask if they're coming in the building? And if we don't like the fact that Mike's not wearing one, as a group of adults, we can talk to him and say, either please wear one, or please stay home, because can't we have that conversation instead of the other? I mean, that's the frustration I have. Why can't we just say, look, there is an issue with this virus. It's not a fake virus. It's not a bunch of hulu. If this board would say, look, Mike, we don't like the fact that you're not wearing a mask.
Dave, why don't you turn to your right and say that to him, please? Mike, what is your going forward? What are you going to do? Are you going to wear a mask?
I already told you what I thought, Lucas. I've already told you what I thought.
If we were to ask you for the board privately, would you please either wear a mask or do the meeting remote?
I'll probably leave and not come back until all this stuff is
We're not
over.
asking you to either.
I'll leave the board and not come back until COVID is over. That make you happy?
Well,
No, I want to hear your opinion and I want to hear your voice on this, but I think we can do it in a different situation by the same way I'm doing it right now.
You're forcing me to do something I'm adamantly against.
But Mike, he's not, because he's asking, he's saying, if either you can wear a mask or you can get on and do that.
I don't have the ability to get online. My computer doesn't do that.
I think we can help you with that. I think Mr. Bader would love to help with that subject.
We can take care of that.
I'm sure that board run laptop can go home with you and we can figure out a way to do it.
All right, then don't make it a policy.
That sounds fair enough. I think that's what Shane was talking about, right? Was the people.
Well, we
I
have.
think the conversation, what we're having, it might be a little tense, but it's still a good conversation to have. Ask him. He doesn't do it because why? He doesn't have the technology, and he's trying to make a point. But Lucas's point is just as valid. He's sitting in his basement because he's positive. He knows he's going to give or potential. Mike could be an asymptomatic carrier. I think asking the question and the board looking him in the eye instead of on an email or something else has validity.
My only other question I have is, for the central office staff, Tracy and Misty and Cindy, what recourse do they have if someone was to come into the building with a generic illness, flu, COVID, who knows, whatever? What do we have to tell them to tell that person to put on a mask?
Well, if Tracy has a mask on, she shouldn't need to be worried if you're convinced that mask.
Well, he's asking something different, which means she would politely ask the person to wear the mask, I would hope.
Is the purpose
And we
of
put
this
screens
policy
up, did we
just
not?
Is that what?
I would say, back to kind of answer Lucas's question, if there was any issue with somebody not complying,
Right.
then the ladies would ask me to get involved and I would take care of that
But have
situation.
we had that issue?
If they don't have one
No.
on, we have extras, we just ask
Right.
them to
And
put
they
it on.
just do it?
No,
So the reason of this policy is for Mike, is that why it's in there? I mean, are we having any other
Didn't know I
issues?
said important.
At times, I know that if
Or
you
is it
have,
a needed
if you have,
policy for the high school?
no, I'm going to say again, sometimes you have people that do attend events if you have this, again, KASB said keep it simple,
But we've already got it.
keep it very simple.
Fascia, we have it for fascia, right?
Correct.
That's in place
Correct.
for fascia.
But when I shared this with you back in
So we've got
November,
that.
when I shared this with you back in November, that was not necessarily an acacia wording yet.
Right.
Now, KASB said you can come up with a very basic policy, and you remove the policy when COVID's over, and I'll be happy. We will be happy to rescind this policy as soon as that happens. But so you know, again, putting this in place allows you, I guess, that enforcement. You can put a note, or you can put a sign on the front of your door saying, "Governor's orders, you need to wear a mask." But it's not a policy that the board says you need to do this. And so that's why KASB said keep your language simple if you do something like this, not only for for visitors, but also for people that attend your events, so on and so forth.
More discussion?
So,
Oh.
yes, I have something else to say. So Jackson, when you said that we should speak to his face or not email, I don't think we should have to, as adults, have the conversation. The sign says wear the mask, we have the expectation that we do wear a mask. I don't think that we should have to ask board members to wear a mask.
Well, as a board member, I don't think I should be getting anonymous emails from somebody that doesn't put their name on it, and then they tell me that people are complaining, and I don't have a chance as a board member to talk to those people, to share with them my thoughts, because they don't want to say who they are. I'm not going to jump down their throats.
Well,
I'll have a conversation with them.
So I'm gonna stop
And
this right now.
you had that with me several months ago.
I did.
You said people were complaining about me going to sleep in a board meeting.
That's correct.
Well, I have sleep apnea. Sometimes I have difficulty.
Mike, it's okay, so
But you should
this
have
is not
told
trying
me.
to be a personal attack on you, okay?
Yeah, well, it's
Shane
kind of that way.
brought up your name, so that's how your name got brought into this, otherwise it would not have been discussed.
I apologize.
She just asked if this policy was just for me.
I apologize for bringing it up.
So what I'm gonna go into, so that was a discussion, so the discussion was, the discussion tonight was face coverage will be required inside all of district buildings.
So,
Right.
I just have a question. If we're making it a policy, do we need to be more specific? Because face covering, that's pretty,
That's a question for you guys, so.
KASB suggested that was the
a face
wording.
covering
The wording. So face coverings would be, I guess you could say approved face coverings if you wanted
I
to
don't know
say,
if we need to say
or
something
approved.
that covers your mouth and nose.
I don't know if we
Something
want to
that,
get
I mean,
into.
They,
I don't know.
here's what they
I'm
recommend.
just asking, I don't,
Yeah.
I mean, 'cause I could wear like a Zorro mask
Good.
and say, of a face covering.
Yeah. Good question.
Right?
And Lucas and I had this conversation before the board meeting via email.
I just-
KASB said to keep the policy, they said to keep the policy very general, if you will. And again, the approved face cover, the face coverings are the ones, again, that do cover mouth and nose. That's what we're working with right now as far as our guidelines. We could make the policy lengthy, but again,
No, I just didn't know if we needed to be, if we're gonna have a policy and refer to that policy, if we have anybody that push back, then I didn't know if we needed to have the policy be more specific on what we intended by face covering.
Again, we could say
Face
approved.
coverage, I don't know what, so.
We could say approved face coverings, because then it would be approval by the buildings and
Yeah.
that way. We could
So
put the,
what do you suggest we add to that?
I have no idea.
Well, so, me again, you know I don't want the policy,
Go ahead, Tony.
but face
I mean,
coverings
what's
is,
what's our,
if you're gonna just say face coverings, the ones that are worse are the gaiters. So the ones, so if you want a face covering, to me, there's masks that are masks and there are masks that are different. Face coverings that are close to your mouth allow you to saturate it with spit and actually make it worse. So if you're really gonna do that, you should say no gaiters.
we
Although I'm going to vote no for the policy itself.
You cannot put that in the district.
But,
Yeah.
but then it becomes confrontational. Every time somebody walks in the door with a gaiter on.
Well, the contact, it goes back to contact tracing and just what the health department shared was just that if you wear a gaiter, that's fine, but you may be quarantined because it wasn't a 2-ply mask. Because I had the question, who's gonna Who's gonna go up to somebody and say, hey, is that a 2-ply or 1-ply?
Well, I know, but it just is confrontational, yes.
I think you
And-
can just say approved face covering.
Now, again, the health department, going to the health department, when they shared with us the 5 different types of masks that are on our website that are approved, again, that was good news and then not so good news, because again, who's going to enforce it, who's going to contact trace it? We felt like all of a sudden the building principals now are going to have to be, at the morning, they're going to have to say, okay, we're temperature checking you, and do you have an approved face mask or not?
Right.
Well, having said that, in talking with Lindsay Payer, Lindsay said, we will be the ones to check on that when we have to do contact tracing. In other words, we'll ask the people involved, were you wearing a 2-ply mask? Were you wearing a gaiter? We didn't want to put a specific, you have to wear one of these 5 types of masks and you have to do it to enter our building. We didn't want to do that, and we didn't choose to do that. So, again.
But are we allowing the shields, those plastic shields?
If they have a mask, like for the upside down.
So that's a face shield, right?
Face shields that go like this are only for people that have exemptions.
Correct. There are people.
Face masks that
So
are
that's why I was saying
they're
like
not
this is
allowed.
super,
No, those are not approved.
So the ones
if we have a
resting on the
policy-
chin, you're not allowing?
Right, that was the decision.
But
that was
from down,
made.
if it's a full face shield,
Only if they have a mask exemption.
You have an
only if they have a mask exemption.
It's a
And how do you get
slippery,
one of those?
it's a slippery slope you're going down.
So
Talk
that's
to
what I'm
Stacy.
saying, if you say a policy with just face covering, but then we have all these things that you've already said
Exactly.
no, then
Mhm.
you don't have that in here in a policy.
Correct.
So-
Correct. Face coverings could be gaiters. Are they going to be contact? Are they going to contact trace
But
if
we
it
allow
was?
those,
Yes, we do.
but we don't allow the other ones.
Because again, they're
But
not
it
covering.
doesn't say that.
We could say
I
face
mean, I'm just
covering.
saying,
We
if we
could.
have a policy that says face covering, just really generic,
Right.
then they can come with any kind of face covering.
Face coverings. We could say face coverings that cover the mouth and nose. We could define it that way.
So what are you currently asking the patrons in every building that show up? So I assume you don't have a lot of people with the chin-based ones showing up.
No, typically it's.
Because we would have heard about it by now.
It's a gaiter or a mask, and then as people come in, if they don't have one.
You just hand them one.
And rarely have I had one that we've even had to hand one to.
So everybody's coming with something.
Yeah.
And almost all have, 99.9% have been appropriate.
Yes.
At the start of the year, we had some issues. I mean, I feel like I had to do the mask police, especially those upside down plastic things, to be quite honest. But then we took care of that, and it's fine.
Perfect. So my point still stands. I think a policy is not good.
Okay, so, we're done with discussion, so does anybody like to make a motion?
Motion to approve the district mask policy as presented.
Motion second, any second?
Can I ask the administrators if they want, are you guys wanting a policy? Do you want a mask policy?
Trying to put it up.
Well, I feel like we've been told, I feel like we've been told that this is what we're supposed to do.
Right.
And so we just follow what the policy has been told to
Yeah.
us, at least I
Following
feel
the
like.
practices.
We're enforcing the practice, that's true.
Yeah.
Right, you're enforcing the whole thing already.
Okay.
We're already
Something
enforcing
already
it.
established.
The executive order on recess.
Yeah.
Right.
The
So that's,
executive
we're
order.
just following it.
We're just following that,
Correct.
so.
So,
And
is there a second?
There's debate whether that's still in place or not.
I say it.
Let's look at seconds. All those in favor, vote on your computer.
And those opposed.
All those,
We were just waiting down.
okay. What is it? Motion carries 5-2.
All right, guys, I will be back when you remove this policy. I'm not quitting the board. There won't be any more meetings.
Thank you, Mike.
Do without me. Till COVID goes away.
But are you going to ask them to
I'll
Do
see,
the
I'll get
computer
with
help?
Lucas, I'll get with Lucas.
What, Lucas?
Well, he said he could,
I can.
These guys.
you could do it?
Talk.
I will work with our technology staff. Thank you.
Fair enough.
No disrespect.
Thank you.
Thank you, Mark.
Okay, math results report. Any comments? Anybody want to talk about that?
Change my thing, I want to.
Yeah, back into this.
The squeaky.
Dog, I thought it was a puppy.
It's a squeaky mouse.
You know,
You really have a squeaky mouse. Huh?
Oh, okay.
Or whichever, I just pulled it up because it's.
I can say that the map at the middle school, you know, our kids still perform above the national average. I tried to go through and identify, you know, what kids backslid and what kids didn't. So look at different risk factors and different things like that. And it was hit and miss. There was no, I could not come up with something when I looked at various kids and things like that to determine whether or not that happened.
So like no COVID sick kid.
Well, I
It wasn't a
even-
trend with sick kids that had
Yeah.
COVID or
Yeah.
isolated.
Even just being out of school, even being out of school for that 9 weeks.
Yeah.
Because some structures are going to be different at home than
And
they
you can't.
are. And I could not pinpoint that it was this at-risk factor versus this or not. I mean, I had some kids that grew quite a bit, and I had other kids that didn't, that were from very different households and things like that. So I tried to go through just based upon what we turn into the state as at risk and look at that, and there was no definitive answer of why a kid makes.
So were we able to look at connectivity? Like the kid couldn't get online and that was the kid that went backwards?
I didn't go into the connectivity, I just went in based upon our at-risk report that we submitted.
Well, I don't know if you could even do, I don't know how you could do that.
I thought we,
I don't know that you could, but.
but I tried to pinpoint if there was a way of why, and I could not.
Well, that's,
Just
I guess that's
assessments,
good.
just so you notice, those state assessments, we didn't give those last year. So
So
that's why those are the older ones.
they're, right, because of COVID,
Same.
we canceled them all.
That's
So the
exactly
same
what my
thing we
question
had
was gonna be.
And just so you know, the ACTs are also in there at the end. The last year's senior group was one of the lowest groups we've had. I've been talking to you guys about that, for those 4 years, from their math scores early on. But I will tell you this, they did better as they went along, on the ACT. If you look, pretty much every student, 57 of them, all took the test. Every one of them. So I was very pleased with that number of all of them, and where we were at, because I really thought we would be worse off, to be honest.
So, just as a curiosity, so if you have 100% of the kids taking it, you have a higher risk of having a lower average.
Oh, yeah, and that's what happened there a little bit, but overall, I would have not thought they were going to be that high.
And they showed longitudinal growth throughout,
Yeah, they
throughout
did.
their career.
Say that again? Oh, growth.
Longitudinal growth throughout their career.
And I can tell you, like this year's class, that will be on next year's, that score's gonna be a lot. It's
Yeah.
just kind of the odd, that's occurred, and I've been telling you guys about that group but they did better than I thought they would. So overall, I'm very pleased with them from the standpoint of what I thought how they were over the course of those 4 years. Even though it's not where I would like for all my classes to be, I'm very happy with how those classes did.
So did we see, well, you didn't see anything on this, and you probably have no way of testing, so it's probably a mute question.
We did do something this year for the first time. We gave what's called a pre-ACT to our freshmen for the first time. And that may give us some indication of where they're at, how close they will be to their...
So it was an ACT test, you just gave it as a freshman?
Yeah, it was a pre-ACT for all freshmen.
Same number of questions, same test?
Pretty much exactly the same thing. They say it is a great indicator of where they're going to be ACT-wise. So it'll be interesting in a few years to see that.
Is there any push for SATs? Not
Yeah.
around here?
Yes, but I think you have to go through the counselor to go through to get that.
The state's really pushing for the pre-ACT for all students in the state of Kansas and the ACT.
Yeah.
Pre-ACT meaning freshman only?
Yes.
You can get it at the 8th grade or the 9th grade level, and then so on the last district test coordinator webinar, I followed up with them to make sure they'd given it, because they're wanting to see all students take that at 8th or 9th grade.
Yeah, we're doing it.
You can do it one or the other, not both, and then they also want to see, the ACT and the work keys being, I mean, they didn't say mandatory, but they did share that that's gonna probably become part of the accreditation process, like how your district is, administering this test, so.
So do we get the data from all the Duke kids that took the ACT because they got Duke scores and then they
I would
invited
imagine
them to?
that's
Do we get any of that data?
It's probably in a lot of the extended learning groups.
Because that's
But that
7th and 8th
doesn't
graders
come to me
that
necessarily.
have taken ACT.
Yeah.
Do we get any of that?
I-
I
we
don't
can
know,
go back.
Sage took it.
We can go
I
back
have
and
not
get
seen
those.
anything.
I know we can go back and find those, but we need to know. who
Like
took-
Sage took it as a 7th grader.
That's when, and that's when they take it.
Yeah.
The Duke,
The Duke thing?
Yeah.
But we don't, that doesn't like translate into any data we get ever in the past.
There's not enough
Yeah,
kids
there's
that
not
do that.
enough.
There's only a few kids.
That's a select.
That's a small sample.
Yeah, it's a real small set.
Extended learning students is typically.
Yes. That's where
That's
it's
not the whole 7th grade.
No.
Just the people that Sage hangs.
Yeah, the first time that
You have to
everybody takes
qualify
it as a
kids to do
freshman.
that.
Yeah.
There's a qualifier, and that's based on.
And that just started this
Very
year.
high, very high MAP scores can get you invited,
Get you invited to that?
Yeah.
That's an invitation only.
yes.
Well, I knew they got invited, but I just thought they invited everyone.
No.
I
That's a
don't know,
very
everybody gets a
select.
medal.
No.
Okay.
Very selective.
Okay.
Well,
Lucas?
there's no BES data on there, so
Right.
if you want to see mine, I'll show mine.
Oh, you are? All right.
So if you remember,
I'll pull it over.
if you remember, we have a program that we've been working with called EduClimber. And
No,
EduClimber,
not really, I decided to try something different.
yes, and EduClimber is a program that, like I say, that we are working with our staff to try to do some analysis, some longevity type scenarios. So again, having said that, I think Darla's going to pull up some information that she's done with the elementary school in regards to EduClimber.
Lucas, did you have something to say?
No.
Oh,
Yeah, I can't see that good.
What are you looking for?
so this is the same program you showed us last year, right?
Yes.
I should have one that says math reports.
It's that one.
Okay.
Click on it.
Yeah, you're on it.
Okay, so, I asked permission just to present my data a little bit differently. Number one, it takes us quite a while to get those graphs and copy and paste them and put them in PowerPoint, and I thought, we're paying for this program, let's just see if you guys maybe like the format of this, because I didn't spend as much time doing this, but I'm not sure if this is data that you'd like to see, but one thing that's kind of cool about this program, so I tried to title the graphs that I made. So this is the BES math scores from this year by grade. So we give the test in the fall and the winter. So this is our fall scores. Over here it's telling us how many students took that. So like the bar is going down doesn't necessarily mean like our scores are getting worse. That means the number of students tested is lower. So you kind of have to hover over the chart to see what is happening there. But if I click up here, like this tells me, I'm sorry, I really can't read what's on there.
You're, right, so it says 20 national means at 175.
Okay, so like that's the mean score. One cool thing about this program and the graphs in here is it's pretty user friendly. So if I wanted to know some very specific information here about this group, I could double click this bar graph, and then I can go in here and see specific. So I have this in top secret mode, so you can't see student names, but all these numbers over here are student names, and this is showing me like all the RIT scores for those kids. So I can see quite a bit of information just by taking a peek at that. So
Is there any way for you to, just on this, to put what the test max score was?
I don't know what the text.
Where you can actually get just for me, it's more of a
Well,
curiosity
so
sake.
if I put in like a ticket to EduClimber, what I would like to see on this is kind of more what we see when I get down here to some different tests. So this is the STAR test here, and this is tiering the kids, like showing us the different colors are showing us like the different performance bands. So on our data wall that we use in SIT, we can get this report where we can see it by like percentile rank. So I can see like so many kids are in like 0 to basically we consider anything under 40th percentile kind of at risk. The 25th to 75th is average, above 75 is above average, but you can see it, but that's not an option right now on this graph, so that would be, I mean, if it was me, I'd probably put in a support ticket for custom support. But
You mean you'd like to see it divided into colors, so you'd have your number
so
one
so
at-risk students,
like
2,
kids,
3, and 4?
Yeah, so we can see how many kids are in that.
And that would give you the
tier.
width.
Yeah.
The color width would give you the number of students.
Yeah, yeah.
But that's not available.
Not.
That's what you're trying to get.
Yeah.
All right.
But you can see, so like here's our fall score for MAP, and then if you come over here, everybody's going up. And then this is the district, so like I have district access in EduClimber, so we can see that, if we click on these, we're seeing that our MAP scores, for the most part, are going up over time here with kids. So again, like these bars just mean not very many kids.
8 kids, it said.
8 kids took that at that grade level this year. So, but the data line is improving. So the next test, what does this one say?
Fall Winter Star 2020.
Okay, so that's our STAR test, and so again, this one is more color coded. So this is showing us, below the benchmark, and these are the kids that are above benchmark. So more green is better than not. And then same thing, the district. The middle school uses some STAR tests, so we can see that again as well by performance tier. So this would be your highest achieving tier, and then these down here are your at risk. And again, all of these graphs are really interactive, so you could click on it and see exactly what kids are in there and where. So that's pretty useful information. And then the same thing that happens with our Ames web testing as well. This is basically by risk category. They tier it. So tier 1, tier 2, tier 3, and then they have tier 2 plus and tier 3 plus, which means high achieving and very high achieving in general terms. So we can just see that, the same thing. These are basically our average scores here. We're seeing that go up, which is very good. There, this is a test, like a sub-test for all the grades there. And then kindergarten and first grade kind of have some different tests. So one of the things on this one, it looks, like there's a lot in the red. And usually every year, that's what in the past, we've shown like the triangle graphs that show, when we give those fall benchmarks, we usually see lots of kids in the risk area. And then by the time we get to the end of the year, we have a very small amount, so we see our interventions work. So this is just, I just thought maybe a different way for you guys to see the data. Actually, I was hoping that I could figure out how to make it, because I know that's one thing you guys have kind of wanted to see is over time, like maybe how one grade is performing. But I haven't quite figured out how to get it to show like multiple years at a time. So that would be something I'd have to also ask technical support for.
How about like for one student? Can you show data for one student only?
Yes.
So just randomly pick a number and can you put that kid in a graph, whatever graph, to show, but you can see one kid in his progression.
Yeah, and there'd probably be a better way. I probably wouldn't use.
Well, I don't care, but you're as an educator able to say,
yeah, so
222
like
is
if I close out of here,
doing this.
Every kid has a data wall. It's really hard for me to do this, like not being able to see it here. I'm sorry.
Are you going to put ACTs in here?
We can.
ACT should talk to this, and that's one thing about EduClimber. Like we have probably more assessments than the other buildings, but we do have to use the technology team a lot to help us, because like we do progress monitoring, and the programs don't always talk nicely to each other, so we have to ask for a lot of help. But they have it programmed so it's supposed to upload automatically. So like the winter maps, we literally just completed last week, and that one's already in there, so it interfaces pretty nicely with NWEA, but the Ames Web test, it's just a pain in the rear, and it's like we constantly have trouble getting the data when term tests are in there. We just completed those, but they're not in there yet. So it's kind of a work in progress, but it's very handy because, I mean, I can just click up here on district or school and drop the grades I want, the test I want, you know, and then I just basically pin those onto a wall.
But you're the only building using it?
Middle
No,
school.
we use it as well. We bring it up in SIT meetings. all
Does
the
it
time.
apply to the high school?
Not as much, because we only have the MAP test, and they're only done for 2 years there. What it applies to is we could see if we get a trend line from his group and from her, how that kid is doing, if we can get to that point, and we can see where that student is at.
And can you use it then in high school with the ACTs and plug in, you're hoping that
The
communication.
pre-ACT is what I'm hoping, is
Yeah,
one of the
pre-ACT, or even the 8th graders, if they're that good, put their ACT in there,
Yeah.
right? I mean,
Well, you can.
and then, so our goal is to get it from you to you
Right.
to you.
Yeah.
Well, and if I'm sorry, because I just can't see well enough to do it, but like if
What
I
do you
brought
want to
up
get to?
Cody Long's data wall, like I would see all of the, so the nice thing is like, so if we want to look at a kid, I could bring up Cody Long and I could see Cody Long's attendance and Cody Long's grades, and I could see Cody Long's test scores. So you see all the information we have about a kid on one screen. I don't know if Cody Long's up there because I don't know his grades.
Don't do that to him.
You know, like, you can see a lot of information about kids at a quick glance. So it's nice because then teachers don't have to go looking, like, they don't have to log into MAP, they don't have to log into STAR. Like when we want to talk about a kid, we can just type in their name and like all their information is there.
It also talks to Skyward too, so if we have a kid that we're concerned about grade-wise, I think it's upper right-hand corner will show their attendance rate.
Yeah, their attendance is there.
96% or whatever, so there could be a correlation. If we have somebody that's 70% and has D's and F's, well, there's probably a correlation there.
And ACT really, right now, we're just seeing classes. This class did this, then the next year this class did this.
They don't
and
give you the
then
individual
class.
scores?
Oh, what's that?
They don't give the individual
No,
scores?
we have those, but I don't know if we could ever download those.
Yeah, they're in there.
The individual scores of
Usually
each
by the
kid.
time those students are, I mean, we're looking at this mainly for interventions, that usually by the
Correct,
time
by
they
the
get
time they're there.
ACT, it's
Yeah.
their second semester of junior year, first
Right.
semester of
Well, I'm
senior year, so.
I'm thinking the progression, so if you see a kid who does this, then their ACT scores tend to do this, then the next kid that's trending, you can intervene back here somewhere.
And that's one thing, like, so if I go back to that, on the test, like on the maps, one of the ones, like I was trying to figure out how to make those graphs look, so like, I could change those graphs, like what I want it to be showing me. They won't be the percentile ranks right now, but, so like a lot of the tests give indicators on how they think kids are gonna perform on the state assessment. So I can format those bars to show you, like, here's right now what it looks like our state assessment scores may look like this spring. It wasn't pretty. I mean, it had it color coded as level 1s or 2s, and then level 3s or 4s. I mean, our bars were really red, like shiny. Like, right now, it looks like we're gonna have a lot of level 1s and 2s on our state assessments. So that kind of tells, you know, if you're looking at the graphs that way, that kind of tells the teachers maybe there's a little work to be done. I mean, I don't think there's any doubt that we're seeing some impact of kids losing last year's instruction. I think our scores are probably coming in lower than they did a year ago in the fall. But, you know, when we give that winter test, you know, we kind of talked about it as a building that we wanted to give those winter tests. We wouldn't give necessarily, but let's kind of see how our kids are catching up and growing. And we saw some good growth in this semester of school.
Well, I think
That's going to be my question if we compared last fall and winter with this fall and winter, just to see what kids lost over 9 weeks and the summer, you know.
Well, I think this is, like you said last time you showed it to, I think this is a great tool. If we can get it to work right for us, it's a great tool because you can see the graphs but that requires a lot of education on the part of everybody using it.
It's a very powerful program that, again, trying to learn it, it's just it has so much capability that, you know, you just have to get in there and mess with it and see what it can do. But
it's that one-stop data warehouse where everything can be put into place instead of pulling up 4 or 5 or 6 different programs. So it's effective that way.
Well, I think that's a tool that today's world needs, is something to predict other students. You can't, a senior and a junior, you're not gonna predict anything, but if you go back and look at their test scores and where they ended up with ACTs, or if they went to college or didn't go to college, then it's a trend to the next kid. And then, because I guarantee you, kids my age, we didn't think about anything beyond the day we were existing until we were seniors in college. That hasn't changed. So if the teacher can have that conversation with the kid and say, look, this is kind of where you're trending.
I ask kids all the time, I'm like, hey, what do you want to do? And they're like, what do you mean?
You mean for
like,
lunch?
what do you want to do in 4 years? Like, talking to 8th graders, you've got 4 years of high school. What is it? I don't know. I've never really thought about it.
Yeah. So I think this helps with that conversation. And I mean, you can sit down at your parent-teachers conference, and I truly believe the kids should be more involved in some of those. Now, that's grade limited, right? Having a second grader there is not going to help. But somewhere in that 7th or 8th freshman year, saying, look, this is what you do test-wise. You seem to love math. You don't do so good in English. Where do you think you're headed? I think it's a good tool, and I think it's good you're using it. It'd be nice to be a little maybe user-friendly. It sounds like the learning curve is steep.
So who has access to this? The
All
administrators?
of us, our school psychologists, our
All teachers?
Yeah.
There's so much data, so
Who's the big, figure it all out, how to work?
Explain this to me.
Well, like, we took a team of people, not last year, but the spring before, to a workshop and
Sometimes they go in, we have
go
teachers.
somewhere. And then we had a lady from Prairie who came down, did it in service, and she actually was awesome. I mean, I'd say she's the guru, and then they had a lot of, like message boards that you can put questions on.
Right.
I signed up for a webinar last week or the week before.
I will.
To the regional meetings,
Yeah,
but of course, like you said, I didn't end up getting to go.
No, I know.
The one, I can tell you why
There is a
the
lot of
sun
support
jumped
for it, just,
is
you gotta.
That's what
ACT has questions that test the student, test the test, and test the question. So if you have a teacher teach a student how to take a test, sometimes you can figure out the questions that are testing the test, and you understand how to answer those, your points will jump for that. So that's understanding test taking. And because there's type H questions, there's type W, Y, Z, and F, all those different types. There are people who are educated enough that if they teach a kid how to take a test, their scores will go up. Now the going down part is probably has something to do with not enough sleep and something else.
But that happens just as much as the other side.
Yeah, so that part I can't.
That's why I always say it's always rebuilding.
I entertain a motion to accept the math
Thank you,
results. Anybody want to make that motion?
Motion to accept the math results monitoring report as a reasonable interpretation of the Board of Education's results policy.
Is there a second? Second. Stacy, second discussion. Vote on your computer.
What?
Six one.
Oh.
Motion carries 6-0. Driver education fees.
There's some information right here. Tracy shared with you as public content in regards to the driver's education fees. Again, we've got a proposal there to leave those fees as is.
Make a motion to approve the driver education fees for the summer of 2021 at $100 per resident student and $300 for non-resident admitted to the program.
Second.
So,
Yes,
I have
discussion?
a question just about, do we ever have kids that want to do this in district and can't afford it?
No, I don't think we've had any yet. And If we
So-
had, we
We
usually.
did take care of
We
it.
figure it out. Okay, that was my point.
Vote on your computer.
I can always tell you that's how it works. We'll figure it out.
6-0, motion carries. Concrete bid,
This is the yearly concrete bid that we put together for the district. Doug Rohr does quite a bit of the work here. He also, again, like I say, looks at different aspects of all buildings, district, throughout elementary, middle, high school, Board of Education, bus barn, so on and so forth. So we did want to try to go a little bit lower this year with our concrete bid because, again, a couple of reasons. One, we've gotten a pretty good hold on concrete in general in the district, which is good. Again, the bids have varied anywhere from, since I've been here, in that $125,000 to $200,000 range. Again, we wanted to try to be a little bit a smaller amount on concrete, just be a little bit less on our projects. So there's 3 different projects that we had bid. The BMS Northeast building. So in terms of thinking at the middle school, right outside of the locker room areas, there's a small patch of grass there that just, the grass, when they mow it, it shoots, they try to keep it away from the building, but it ends up inside the building. It's where the kids, for football practice at times, they're out there, they're just, those doors get open quite a bit. The grass, especially during the spring and summer, and even in early fall, it just becomes an issue. They want to concrete that area there, kind of give those kids a chance to, like I say, to have a place where it's not just grass clippings all over, it's blowing into the building, and so on and so forth. So that's the BMS Northeast building. Questions?
Is that gonna get rid of the curb?
No, the curb's gonna still be there. It's
Why
just
don't we
gonna
get
come-
rid of the curb?
Well,
And just make them park on the outside?
that's something Doug and I didn't discuss, so I don't know even if that's
That way we
possible.
don't have people walking out of that and stepping off a curb, it's just flat.
I would have to check with them and see. It's very possible we could do it. Of course, it'd be an additional fee.
There's not a lot of people that park there either, so I don't see that would be an issue.
So I don't know. I guess we
Well, it's more for the people walking.
Right.
Just get rid of the curb. If we're gonna do concrete, so you're basically concreting all the way to the building,
correct.
because there's, 6-8 feet of grass in that, something, it's not a lot.
Yeah, probably a little more than that, but I don't know exact
Okay,
dimensions on that. But yeah, it's just
Which is flat makes more sense to me than a curb at all.
it's kind of a nuisance area. So that's what we're trying to do is get rid of that area where it ends up blowing grass into our
That's
building.
where they Foursquare, right?
Yes.
All the Foursquares
Yeah.
are good there.
It's on the parking lot side where they do the Foursquare.
I was feeling kind of bad because those pictures I was looking at, I was like, I don't see anything wrong with that concrete.
And-
So are you just gonna put the concrete from the drainage to the,
It's going to fill in that whole area so that there's no grass,
All the way.
that don't have to worry about mowing it, and also we don't have to worry about it tracking into buildings. So it's going to help our custodial staff, it'll help our maintenance staff, could help even potentially with more drainage from the building, even though we have those concrete sloughs there that come down off of the drainage, the gutters. It'll help it even more, and the ideal scenario is to keep as much moisture away from your building as possible. So anyway, that was an area. The second project too is the north end of the BHS parking lot. I think I shared some pictures with you guys about that, and that's the next big chunk of concrete at the football stadium, track and field area. You'll see some pictures of some pretty fractured concrete there. It's just a safety piece, and so far, like I say, knock on wood, these are the 2 main areas that we really need to look at doing this year. Project number 3 is one that we at least wanted to get a proposal on. We're not going to look to do that this year. That's the area in the visitors' bleachers of the football field. Again, it's more of a grass and weed type area that they've got to constantly mow underneath bleachers. And so that area is just we spend a lot of time upkeep in that area for our visitors because we kind of want to have a nice area for when they come to track or football games or whatever. But that $58,000 is a little steep for us this year. We were trying to keep concrete in that $100,000 range because of some other projects that we were doing. One specifically, again, the baseball, softball restroom and concession stand. So we feel like this project 3 could be one at a later date. So that would be my recommendation, to do project 1 and project 2. in the amount of $100,257.50.
So when you're looking south at this picture, the stuff to the east is what we just did for all the flooding and stuff, right? And then to the west is where all the new stuff is going to occur?
Are you talking about the middle school pictures?
No, the picture of the large parking lot, because we just
Yes.
redid the
Yes.
west side, right?
Yes, it's going to,
Or the east side.
The east side, yes.
East
It's
side.
going to continue on that next
So
section.
the west,
It's going to continue
For the
to go to
west.
the west, yes. It'll tie in with the section that we just did, the new section.
okay.
Good question.
Because it looks like part of this picture is the new stuff, but I think that you're just trying to give us a
To show that that's where it's tying in.
tying in right there.
Yes,
Okay.
yes. Good questions.
Okay. Motion to approve the concrete bid in the amount of $100,257.50 from Burlington Construction for projects number 1 and 2.
Second.
Monique seconds. Any discussion? All in favor, vote on your computer. Six oh, no motion carries. Executive session, I don't have anything. Does anybody have anything? No executive session. Move on to retirement.
Motion to accept the retirement request of Renee Strotter with grant under paraprofessional effective December 19th, 2020.
Second.
Second. All those in favor, vote on your computer. Motion carries 6-0. Sorry. I'm waiting on it to pop up here. Debriefing. I think it was a very good discussions, candid discussions tonight, so appreciate that, and I do appreciate the work that everybody's put in on all this stuff. So.
Yeah, I do appreciate our administrators and the tough decisions that they've had to be making lately. You know, I do appreciate parents bringing concerns in a respectful way, so that's good.
I think we do need to make sure that we get Mike computer set up. I think he has a valid input, so we need to make sure that he's brought up to speed. So nothing else before the board. We adjourn.
Music concert, go great.